My name is Judie Vankooiman, and you're watching Life Issues. My August show is Mass Aging Access, and my guests are Betsey Crimmins and Ellen Taintor. Welcome, ladies.
Thank you.
Betsey, I'm going to start with you. What is your professional background?
Well, I'm currently the Executive Director of Mass Aging Access, but most of my career was spent as an elder law attorney at Greater Boston Legal Services. And in that role, I work very closely with the ASAP network, which we will be talking about with you, and have enormous amount of respect for the work that ASAPs do. And when this job opened up, it just felt like a perfect segue from working with the ASAPs to now advocating on their behalf.
Okay, great. And when did Mass Aging Access start?
I actually have to take you back to 1965. So in 1965, Medicare and Medicaid were enacted by Congress, as was the Older Americans Act. And through that act, the network that we currently have was established not just in Massachusetts, but across the country. So basically, each state had a state unit on aging, and each state had nonprofits that were set up to provide services and supports to older adults. We incorporated as, we were initially called Mass Home Care because the agencies in Massachusetts were called home care organizations. And we incorporated in 1982 and actually changed our name to Mass Aging Access just last year to really reflect the fact that we also work with younger people who are disabled, and that we do a lot more in our network than just home care.
Okay. And why was it started?
Why was it started? So it was started in large part because of the change in federal law, which was absolutely a recognition that older adults, you know, after people work and retire, a lot of people were just dropping off the cliff. They didn't have, prior to 1965, access to health care anymore because it was based on their employment. So it was really went hand in hand with both Medicare and Medicaid. Our agencies, most of, if not all, have been around for over 50 years at this point. And what I love about the ASAP network is that they are very deeply embedded in their communities. So you might call up Mystic Valley Elder Services in Malden, and they'll say, and ask a question. They'll say, well, we don't do that, but we know the Winthrop Council on Aging does. And that's invaluable to know not just what your own agency does, but what all the other nonprofits in your communities can provide, the services that they can provide.
Great. And Ellen, I'm going to switch over to you. What is your professional background?
Well, I actually spent 17 years working in assisted living residences. I got into that field like so many people because I helped my parents move into a continuing care retirement community, and just seeing how challenging it was for them, I ended up working in assisted living in Arlington and then in Swampscott. And during that time, I also got a master's degree from UMass Boston in Management of Aging Services through their gerontology program. And I kind of like to joke that I spent 17 years trying to convince people to move to assisted living, and now in my role as assistant director, it's, you don't have to move to assisted living, you can stay home. Let's help you stay home.
Yeah, because more elderly love, they don't want to lose that independence.
Absolutely.
Yeah. So can you please tell us what your core principles are?
Happy to. So the Mass Aging Access core principles very conveniently spell out the word access. So we have advocacy, collaboration, connection, equity, services, and support. So we advocate for home and community-based services and for the funding to provide those services. Collaboration, we encourage our 27 members to collaborate and speak with one voice, with the power of that one voice brings. We try to connect through our member agencies, older adults and people with disabilities with the services that will be beneficial. We work for equitable access to the services throughout the state so that no matter where you live in Massachusetts, you have those core services available to you. And then services, again, the services that our member agencies provide, making those available, and supporting our members through education and training opportunities.
Okay, great. And who are your member agencies?
So our member agencies, we have 27 members, and they are a combination of Aging Services Access Points, or what we call ASAPs, and also Area Agencies on Aging, or AAAs. The key difference, really, so ASAPs are primarily funded by the state, and Massachusetts is very fortunate that we have state-funded programs because many states don't. They depend entirely on federal funding. So the state funds the home care program, which we'll talk about, as well as some other programs. And then the AAAs, or Area Agencies on Aging, are primarily funded from the federal administration through the Older Americans Act, which Betsey had mentioned. And many of our members are both AAAs and ASAPs. It really doesn't matter in a lot of ways to consumers, just knowing that the programs are available throughout the state. Each of these agencies has its own catchment area. So for your Winthrop viewers, as Betsey mentioned, that would be Mystic Valley Elder Services in Malden. If people who are watching this are curious who their agency is, they can go to our website, agingaccess.org, go to our member lookup page, type in their city or town, and they'll find out who their member agency is.
Okay, awesome. And Betsey, how many calls are received by ASAP Network?
About 190,000 a year, give or take. So one of the core services is called INR, or Information and Referral. And that's not just answering the phone, that's answering the phone, listening, and then being able to either do an intake or make that referral to the Winthrop Council on Aging, because that's the more appropriate place to send somebody. So it's very busy. One of the things that I say is that I think ASAPs are one of the best kept secrets in this state, because unfortunately a lot of people don't know what an ASAP is, or are in a position where their mom is 78 and she's perfectly healthy, and then one day she's not, she has a stroke, and where do you even start? And just listening to Ellen explain, well, it's 24 ASAPs, but it's 27 agencies, but 21 are both ASAPs and AAAs. That's confusing in and of itself, but actually trying to navigate the landscape of services, who does what? Mom needs X, Y, and Z. How are we going to make sure that's in the home so she can go home as opposed to a nursing home? We are a one-stop shop, and part of what we are trying to do, one of our top priorities is to get the ASAP brand out there more, because one of our members has this great tagline, which is "Know us before you need us," which I think is wonderful, but most people don't want to contemplate, I was healthy this day and I'm not the next day, or even think that about your grandparents or your parents. So a lot of the calls, the 190,000 calls, are because a crisis has occurred. So it's not planning, and it's not asking, oh, I'm a healthy 79-year-old, I'm wondering what's available. It's my 79-year-old mom, fell, and I'm in Texas and my brother's in California. How can we get some help?
That would be tough stuff. Betsey, what is your mission?
Well, I'd like to say very simply, the mission of Mass Aging Access is to support our members by doing, as Ellen said before, doing advocacy. But the larger mission really is to help people age where they want to. And the vast majority of people, if you asked a group of older adults, like, would you want to end your life in a nursing home? Obviously, nobody's going to raise their hand. And unfortunately, there are some people where that is the most appropriate setting. But the vast majority of people can remain in their home or in their community with the kind of services and supports that the ASAPs provide. So really our greater mission is to help people stay at home where they want to be, which is the lowest cost service. It's much less expensive than a nursing home, than going in and out of a hospital. There's lots of literature that shows that people have better health outcomes, and you absolutely have a higher quality of life. So ultimately, that is our our sort of big mission.
Okay, great. And Betsey, what are all the services?
You said we only had 30 minutes, so I don't think I can describe all the services. What I thought I would do is start with the services that the Older Americans Act funds, because that's sort of core services. So home delivered meals. I think most of us know or have heard of Meals on Wheels. So it's for people, it's not just for anyone, it's for people who can't shop on their own anymore. They can't prepare meals on their own anymore. So meals are brought to them. And it's not just a meal, it's trained drivers who, or volunteers sometimes, who do a safety check. So there's a whole protocol if somebody doesn't come to the door. And we have heard of multiple instances where people's lives were saved because they didn't come to the door that day. And because of the safety check, they were able to get services to come in and get them to the hospital. But it's also socialization. I think we've heard, certainly since the pandemic, how really hard being socially isolated is on everybody, from young kids all the way up to older adults. But I think especially for older adults, sometimes that driver's the only person they see. So that chat that they have, feeling that they have someone to talk to, there's someone who cares enough about them to stay and talk, is very meaningful.
Yeah, that's right. So great for them to come to senior centers too, because
Yes.
that might be their only outlet, or
Absolutely.
and stuff, because they
Right.
might be totally by themselves and stuff. And great way to make friends and,
Yep.
and involve themselves in activities.
Yep. So the INR, the information referral that I mentioned before, caregiver support. So there are countless numbers of people providing care to family members, to friends, like heavy duty care, while also working full-time jobs, having their own families. That can be very stressful. It can be daunting to think of, well, my mom just came home with, a catheter, what do I do? So we provide respite services and trainings and just general support groups for people who are providing care to loved ones. We also have, I'll just start to reel them off now, behavioral health services, money management services, protective services for allegations of elder abuse, adult foster care programs. Help me out here. There's so many that it's
Hard to
sometimes
remember
hard.
them all.
An
Yeah.
ombuds program, which goes into nursing homes, and that person is the advocate for people in a nursing home who many instances don't have family members who visit them, don't have anyone. So if they have concerns, they can talk to the ombuds person. So it's options counselors that do a broad array of help, including for people who need to find affordable housing. So they help them navigate that really, again, daunting application process to try to get into affordable housing. So lots of services. There's core services that the ASAPs provide, and then many others have very unique programs. Like one that I love is for people, lower income people who are very attached to their pets, but it becomes costly to take care of their pet. So they help purchasing food, right, or paying a vet bill. So that's a really special program, and several of the ASAPs do that.
Nice.
Yeah.
Very good. Okay. And Ellen, please tell us about the Hospital to Home Partnership Program.
The Hospital to Home Partnership Program is a wonderful program. It was grant funded starting in 2023. It was through Executive Office of Health and Human Services. So it was a 2-year program that technically wrapped up in March of this year, but a couple of our sites still have been able to extend the program. With that, the program, it's a partnership between the ASAP and a specific hospital. The ASAP has a liaison person who is on site at the hospital and works very closely with the hospital staff to help facilitate discharges back to the community. So the whole goal behind the Hospital to Home program is it's in part a nursing home diversion program. So rather than the default being, oh, this person needs some help, we'll send them to a nursing home, the Hospital to Home liaison can help put services in place so somebody can get back to their home. It also it gets people back out into the community sooner, which I think is critical. I mean, I think nobody really wants to spend one more day in a hospital than they need to. And we have, generally in Massachusetts, there's been roughly 2,000 people a month doing what they call boarding at hospitals. So they don't need hospital level care, but they can't place them. They haven't figured out how to get them to a safe discharge. You have nursing homes that can't take referrals because they're short-staffed. Nursing homes are closing. There's so many issues there. So that boarding issue costs Massachusetts hospitals roughly, I think it's $400 million a year. So that's a huge expense that just doesn't need to be there. If we can get people back home, back into their community, bring in the services they need so that they can be healthy at home and not hopefully end up going back to the hospital. It's really it's a win-win, and it's a great program. And so, as I mentioned, some of our ASAPs have been able to find alternate sources of funding now that the grant program has ended. Some maybe got a little bit of a later start with the grant, so they've been able to keep their program running through the end of the year. It is limited to certain sites, but we've heard nothing but incredibly positive feedback from hospital partners, and in fact some hospitals who weren't in the original grant areas have reached out to say, like, how do we get this? We want this.
Great.
Yeah.
And Ellen, who does the H2H program help?
Yeah. So the hospital to home program, as I mentioned, it helps everybody. It helps hospitals who have these patients that they're caring for that don't need to be there. It helps their staff facilitate a safe discharge. It helps, obviously, consumers because it gets them back home where they want to be sooner. So it really helps everyone across the board.
Great. And can you please tell us some of the case studies?
Sure. So I did bring my notes because I wouldn't be able to remember this all, but we have a number of case studies. But this one is actually from Melrose Wakefield Hospital. So a 61-year-old divorced male who was referred to the hospital to home program in March of 2024. He had lost his job. Then as a result of losing his job, he was unable to pay his rents, so then he was evicted. So at the time that he was hospitalized, he was homeless and living in his truck in the Revere-Malden area. So he was admitted to Melrose Wakefield due to not being able to manage his diabetes because he couldn't afford his insulin. He had one sister who lived out of state and could only provide very limited support. So his hospital to home liaison was able to help this gentleman access the unemployment website and get his insurance information together, and then get that information to CVS so that they could expedite getting medications for him, because there was no plan for him to have medications without this. He also had no money for gas or the medications. So the hospital to home liaison applied for funding to get a gas card and co-payments for his medications. They also, this is through Mystic Valley Elder Services, the ASAP we mentioned, who would cover the Winthrop area as well. And they were able to gather food and toiletries from what they call their emergency pantry to support him. And then this is where I think it's just, there's so much creativity within this network. So this liaison had to think outside the box to think about how to meet this gentleman's needs for bathing when he's living in his car. They applied for funding to cover a 3-month YMCA membership so that provided him a place for showering in addition to some exercise and companionship, as we just talked about. Also made referrals to the Malden Warming Center, which is a great resource during the winter months, and a list of resources for rooming houses. So after a month, he closed out of that program but moved into a different ASAP program, which has more intensive case management and support. He's now receiving unemployment benefits, or he was receiving unemployment benefits, but has now found a job. He's managing his diabetes. He's attending follow-up medical appointments. He is unfortunately still just on a number of wait lists for housing, but the agency is continuing to support him and trying to get him permanent housing, which is like a huge challenge in Massachusetts and any part of the state. So it's just, it's just one example of the ways that these liaisons can really make a huge difference in somebody's life. I mean, if this gentleman had been in the hospital and just been discharged back to his truck, he would have been back in the hospital in a week. It's like it's not solving the problem. And this hospital to home liaison just used so much creativity and thought and problem solving to really make a difference in this person's life.
She was a special angel for
Yeah.
him.
Oh, for sure.
Absolutely.
Yeah.
Yeah.
Awesome.
Yeah.
Awesome. And Betsey, what is the home care program?
So I would probably have to talk about it in two separate ways. There's federal programs funded through Medicaid or Mass Health, and then our state-funded home care program. So in essence, it's the programs that provide the home and community-based services that allow people to remain at home. So when you think about it, if you're in a doctor's office or you're in a hospital, all of that is medical and it's essential, but it doesn't mean, like, none of that translates to now you're home, and as I said before, you can't prepare your own meals, you can no longer drive your car, so you can't go to the laundromat, you can't transfer in and out of your bed on your own, you can't take a shower or have personal care on your own. So the services that we call home and community-based services are non-medical but essential services to keep people healthy, which they do. So we have two programs. One is a Mass Health program called the Frail Elder Waiver, and the other is a state-funded program called ECOP, the Enhanced Community Options Program, and they are specifically designed for people who have had a nurse do a full clinical assessment and determine that, but for these services, these folks would be in a nursing home. So sort of to the point that Ellen made before, the cost savings of keeping somebody home versus having them go into much more expensive settings. Unfortunately, with the ECOP program, because of state funding problems, there were caps put on the program back in February, beginning in March. So we've been able to serve less people in that program, which is unfortunate. And we have grave concerns about the cuts that are coming from the federal government over the next months and years, because that will also cut into our Mass Health budget very significantly. So there's also other home care programs for people who don't meet that level of care but still have care needs. And in the state home care program, there's different levels of functional limitations that an ASAP does the assessment and figures out, they may be what's called a level 3, so they need X, Y, and Z services. They may be a level 4, so they end up getting what they call just a meal. And a lot of times that group of people actually have greater needs, but they're unwilling to say yes to having somebody come into their home for, I think lots of reasons. People are reluctant, but they will take the meal because that's sort of the gateway into having more services come in over time.
Okay. And Betsey, what are the Massachusetts demographics?
So we have in Massachusetts a very rapidly aging older adult population. We define older adult, we use the federal definition of age 60 and older. And when you think about it, the baby boomer generation, which I think we all know is the largest cohort or group of people in, as we define generations, the first baby boomers are close to 80 now. So there's just lots more people who are living between the ages of 60 and 80, which is when our home care services start. But almost more importantly, and sometimes ignored, it's the fact that people are living longer. So that's a really great trend. But it also means people are oftentimes more frail or more vulnerable. Their spouse passed, their siblings passed, so their support network has thinned out or is now non-existent. A lot of times people don't have children, or their children are far-flung all over the world even. So these services become even more important for that group of people who really would end up in a nursing home but for the services that the ASAPs provide. And this trend, this demographic trend, is expected to slow down sometime between 2030 and 2035. So we have many more years, and that simply means that the baby boomer generations have moved, and now we have Generation X coming into age 60 plus. But it doesn't mean the work will slow down, because we routinely see people in their mid to later 90s into their hundreds. And when I first started working, if I had an older client, it'd be someone who was like 80 or 82. And now an older client would probably be 98.
Wow. And Ellen, can you please tell us what the home care program Care Saves Money?
I'm sorry, how the home care program saves money? Yeah. So as Betsey mentioned, these are home and community-based services, which cost a lot less than having somebody in a nursing home. It can cost, a typical home care plan might be $10,000 to $20,000 a year, versus you're talking very conservatively $80,000 and up in a nursing home. So you can see there's huge savings financially for the state, for consumers, but not just cost savings. Again, it's quality of life. Nobody wants to be in a hospital longer than they have to be. People don't want to go to nursing homes. They want to be at home. So it's really an upstream intervention.
Okay, great. And what is the conclusion regarding the home care program?
Right. So as I just mentioned, it's an upstream intervention that helps, keep people at home safe, healthy longer, keeping them out of hospitals, keeping them out of skilled nursing facilities. It really is, home care really can be looked at as part of the whole healthcare continuum. So rather than a separate entity, the goal is for somebody to be at home as long as possible, saving money for the state, for consumers, for insurers, for everybody.
Okay, great. And how is Mass Aging Access funded?
We are funded through membership dues. So our 27 members provide annual dues that help manage the operations of our organization. Those also help with our two main events, which I did just want to mention briefly. We have our fall conference for ASAP staff, which happens in September. And then the other huge event is every spring we do an older adult lobby day at the State House. And I think you were there this last year.
First one.
Yeah, and we typically have up to 500 people there. It's huge, it's impressive, it's energizing, it's a wonderful day.
Yeah, so great. And Betsey, can you please tell us some resources that will help the clients?
Sure. I think the most important resource is really our website, because as Ellen said, if you could be the son in California looking for a mom who broke her hip in Winthrop and have no clue where to start, you go to the website, it'll tell you to call Mystic Valley Elder Services. And again, you go through information and referral, and he just has to start talking about mom. They'll locate mom, and they'll figure out how to make sure mom can stay at home safely until she rehabs and recovers. Our state unit on aging is called the Executive Office of Aging and Independence. It changed its name in the last year, a few months ago. They have lots of information on their website as well about home and community-based services. I actually think one of the biggest challenges for older adults is not that we need more programs. They're all there, but it's really hard to figure out where to start and how they're connected. And that's what ASAPs allow you to do. It allows you to talk to somebody who could tell you how you in your community, whether you're in Chicopee or the Cape or Bristol down south or here in Winthrop, what you're entitled to, how you can get these benefits, and help you through that process.
Okay, great. And Betsey, can you please give us the contact info to reach either one of you?
Sure. Would it be, I guess, our email?
Yeah. So our website again is agingaccess.org, and you can find a lot of information there. And the best way to reach out is through the general email address info at agingaccess.org, and that'll come right to me, and we can route it to the appropriate person.
Okay, great. I'm sorry, but that's all the time that we have. Thank you both for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.